Hi everyone, thank you so much for joining us today. Today we're joined by Dr. Pendo, our Senior Medical Director, Experience of Caring. In this role, she leads Intermountain's efforts to help our well-being of the physicians, APPs, and our patient experience. Dr. Pendo also practices internal medicine at Intermountain Avenues Clinic. Thank you so much for joining us today. We really appreciate it. Individually and societally, we're experiencing unprecedented levels of emotional uncertainty right now. It feels so easy to experience anxiety over our economy, our employment, finances, relationships, and of course our mental and physical health, especially during COVID-19. Everything seems like it's out of our control. Is this a normal thing to feel right now?
I think it's really normal, first of all. And secondly, the one thing that I've reflected on most in the past month is how many things I really believed I had control of, but I don't. And so this whole last 4 weeks has been an opportunity to really kind of reevaluate what I believed I had control over, to get comfortable with uncertainty, and also recognizing that feeling of uncertainty can manifest itself in a variety of emotions. It can be fear or anger or sadness. And as I was reading last week, a lot of that can even be a grief-like response to a change in the way we knew our world. But I think that this last month has really changed the way we look at all the things we took for granted as what we knew, and then also what we had control over. And also recognizing that uncertainty can cause or lead us to have many different emotions: sadness, anger, fear. And a lot of it is all rooted in grief of recognizing that things are different and they have changed, and not really knowing when it's going to go back to how it was before.
Yeah, I feel like the word grief people don't always necessarily associate with what's happening right now, but we are kind of grieving the loss of normalcy. Not being able to go to the gym like you normally would, or hanging out with your friends like you normally would, or family. I know for myself it's been a pretty big adjustment on changing my normal routine, and it's really great to be able to actually do these Facebook Lives because I get out of the house and get to interact with people a little bit more. So that's something I feel like I still have a little bit of control over, which is great. When you talk to your patients about uncertainty, either right now or in general, what are some things that you tell them about how to cope with this?
I think that's a really great question. Specifically in my specialty, which is internal medicine, there are many times that we're uncertain. We're uncertain of a diagnosis. We're uncertain of what tests should be done. We're uncertain of outcomes. And I have become more skilled at navigating those uncertainties with my patients as we think about, what do we know? What can we do? What are potential scenarios? If we do this, this might happen. And also recognizing that our unknowing now doesn't expand to everything. So just because there's uncertainty in this one situation doesn't mean that it will apply everywhere, and also thinking that it will never end. So as we talk about uncertainty, our minds can go to the place of it's always going to be like this, and reminding ourselves that it won't. This is a point in time, and recognize that for what it is.
Is there a strategy that you recommend people use in their everyday lives? Not just right now, but when it does eventually go back to normal, what are some strategies that they can use?
Well, I was especially pleased to be asked to visit with you today to talk about uncertainty, because I think that there are some things that we can do. And one of my favorite strategies is thinking about the circles of control. So that inner circle, that's you, or that's me. And that's what I actually have control over. I have control over what I think, feel, do, and say. That next circle is the circle of influence. And I think especially with patients in talking about diagnoses and treatment plans, my role is to influence, but ultimately the decision of what we decide is up to them. So I think about these circles of control in my work setting, my home setting, and my physician leadership setting. And it can apply to all of those areas. That final outer circle is something that I've got no control over. It's like the weather or my favorite football team or my favorite basketball team. I've got no control over those. So when faced with uncertainty or feelings of fear or worry, I remind myself of those circles of control, reminding myself that I control what I think, feel, do, and say. I have some ability to influence, but just like I can't control the weather, I can't control what you think, feel, do, or say. I can't control what the virus is going to do or what our economy is going to do. And I think that when I group things in that way, it's funny, but it gives me a sense of control as well.
And for someone who's never experienced that circle of control method or strategy, how do you talk to someone about what you're trying to do yourself too? If you want to use that strategy right now, what's a good simplistic way to talk about it with someone else?
So I often draw the circles.
Okay.
That's a very practical thing. And then really talk about what they're worried about and help them figure out what circle that fits into. And for me personally, there have been a couple things that I've been focusing on so I can control my ability to exercise. I can control what I think about things. So I might journal, I might do some meditation as a way of taking care of that for me. My Instagram page has a daily self-care post, and it's really required me to pay attention to how am I taking care of myself today? What am I noticing that's actually good? And even though it's a little bit hard, I mean, there have been days that it's 8 at night and I thought, I haven't taken care of myself yet today. What am I going to do? And I've noticed that as I'm more focused on taking care of me, I'm noticing more good things that are around me. And that feels really nice.
Yeah, I actually have a friend who started something about a week ago called the Three Dailies, and the first thing she's doing is taking care of herself, and then seeing what she can do for those around her and her immediate family, and then the community. And it's really helped her with this level of uncertainty and kind of figuring out what her next steps are. And I saw her post that on social media, and I was like, this is a great idea. I think that you can get really good ideas from the people you're following that are great for yourself.
Yeah. And I think it's being somewhat open, right, to seeing what's available and what other people are doing and recognizing, is that something that will work for me?
So is this how you're managing uncertainty, or is there other tactics that you're also using to kind of manage your own uncertainty during this time?
Well, my kitchen drawers are very organized.
That's great.
Yes, I've recognized in my self that gives me some degree of comfort in having my things organized. Other things that are useful for me personally are reading a book or cooking or looking through cookbooks and picking out recipes, scheduling Skype or Facebook calls with my family who almost all live out of state as a way of staying connected.
Yeah, you bring up the staying connected part. I do a weekly call with my boyfriend's family, and last night we were talking about how we hope to continue this outside of just this experience right now, because it's something that we have probably taken for granted that we could easily get on a plane and go visit someone. So I think it's interesting to take what you're doing right now in the new normal and apply it to what hopefully is normal soon. So that's been really interesting for me.
Yeah, I love hearing that. And I hope that when we think about this time, we can say these were things that were really good, and we want to continue them.
So what is some advice that you would give to people who are still facing uncertainty in the future outside of just COVID-19?
Well, I mean, I think there's some things that we've talked about before in terms of mindfulness and deep breathing and the things that give you comfort. But there may come a time when additional resources are needed. And I think that you've got some resources that you're going to show at the end of our time today for calling the COVID line or the emotional relief hotline, because sometimes you do need more help.
Yep.
Sometimes you do need to ask and say, I've done everything I can do on my own, and now what else do I need to do to feel better?
Yeah, and being able to talk to someone that isn't necessarily your immediate family, I think, is also important. Being able to have a conversation with someone who's seemingly a stranger, I feel like you almost could open up a little bit more about what you're feeling. I don't know if you feel that way,
Yes.
but
There's not as much emotion when I'm speaking with someone who I'm not related to, and my family we've had to agree to boundaries at work because we're all working from home, and having that unbiased view of situation or whatever I'm feeling has been really useful. So taking a step back from having everything, all my conversations, either work related or related to my family.
Yeah, that's great advice. Is there anything else you kind of wanted to mention to us today about uncertainty and how to cope with what's going on right now?
I think the final thought is that recognizing the feelings and naming it is a really useful tactic, knowing that it's not going to last forever. The image I have in my mind of kind of as riding a wave, with that feeling and knowing that if I ride it, I'm going to come into shore and be 2 feet on the ground. That to me is a final useful thought. Hopefully the audience will appreciate that.
Well, thank you so much for joining us. And if you guys have any questions at all about COVID-19 related to symptoms or feeling like you may have COVID-19, you can call the COVID-19 hotline at 844-442-5224, or you can call our newly launched emotional health relief hotline. It's 833-442-2211. Thank you guys so much. We'll talk to you later.